Hello. I'd like to continue our talk about our discussion about the autonomic nervous system, and I'd like to relate it a little bit more into the categories of medications that we might use to stimulate or to act like either the sympathetic or the parasympathetic system. Now, as a quick review, when we looked at the sympathetic system, we said this is the fight or the flight. This is the getting away from the bear or getting away from the crisis type of reaction. Our heart rate increased, our bronchioles dilated, our blood vessels dilated to our heart, but they constricted to our skin and to our intestinal areas. Our pupils dilated, our blood sugar increased, so we had all of that nice energy to run away. Our saliva decreased, our urinary output decreased, or our reflexes of the bladder decreased, and so did our peristalsis. So those were all typical reactions of the sympathetic system. On the parasympathetic side, we've made it away from the crisis. So it was the rest and digest section. And when we looked at the heart rate, it decreased. Our blood vessels dilated or went more towards a normalized diameter. Our bronchioles, I put constricted here, but they went back to more of a normal size. Our pupils constricted. Our blood sugar came down to more normal. Our saliva increased because now we were able to eat those meals. We were able to digest the food. We were able to start our urination process again because there was no danger, and our peristalsis started to increase. So all of those things are part of the parasympathetic system, what we determine or we call sometimes the rest and digest. Now, when we're looking at the medications, we have to look at the neurotransmitters that are primarily involved with each system. In the sympathetic system, we look at the neurotransmitter adrenaline. Okay? Adrenaline is a neurotransmitter that's a stimulating neurotransmitter, or an excitatory neurotransmitter. In the U.S., we look specifically at epinephrine and norepinephrine. On the parasympathetic side, we look at the neurotransmitter acetylcholine. And what you're going to look at with these medications is that when we're looking at the different types of classifications, you're going to see that acetylcholine or cholinergic is going to be part of the root of the medications. So let's look at some of the endings that you might see when you're looking at these medication classifications. Well, one of the most common ones is going to be mimetic, okay? If we look at the root word mimetic, we think, well, that sounds a lot like mimic, okay? And that's exactly what it is. We're mimicking the system. So if we're a sympathomimetic, we're mimicking the sympathetic system. If we're a parasympathetic mimic, that's a hard word to say, we're mimicking the parasympathetic system. Another route we can look at is the adren, okay, which is like the adrenaline. So an adrenergic means it's stimulating the adrenergic side or the adrenaline side, which is part of the sympathetic. On the parasympathetic, we'd have a cholinergic, so a stimulation of the cholinergic or the acetylcholine part. Another word you might see when we're looking at these medication classifications is the word agonist. Agonist means it works with or stimulates, okay? So if we're stimulating the adrenergic side, we're causing a sympathetic reaction. If we're stimulating the cholinergic side, we're having more of a parasympathetic reaction, okay? Now, another word we can look at, there's lots of words. Have you noticed this? But if we can understand the roots, we can understand the actions. So one of the other words that we see is the word lytic. Lytic means to lyse or to stop or to cancel. So if we're canceling out the parasympathetic side, okay, if we're lysing that, a parasympatholytic drug, then we're actually stimulating the sympathetic system versus or vice versa. On this side, if we're having a sympatholytic reaction, we're lysing or stopping the sympathetic reaction, we're having more of a parasympathetic reaction. Another word that means much the same thing is antagonist, okay? An antagonist. If you're antagonizing, you're working against. So if you're working against the parasympathetic reaction, okay, you're an antagonist, you're actually having a sympathetic reaction. And on this side, if you're antagonizing, working against the adrenergic side, if you're an adrenergic antagonist, you're stimulating more of the parasympathetic reactions. Another word we might see is the word blocker. Lots of words that mean very, very similar things, but we use them in different classifications of medications. And if we can just understand the roots, it's really quite simple to understand the actions of the drugs. So if we blocked the parasympathetic reaction, we'd be having more of a sympathetic reaction. Over here, if we blocked the adrenergic system, we'd be actually having more of a parasympathetic reaction. Okay? Now, when you look at the sympathetic reactions or the sympathetic system, oftentimes they break it into what we call the alpha and the beta. Okay, and that's a whole other discussion. But sometimes we can get real specific when we're looking at types of adrenergic blockers or what portions of the sympathetic system we're actually going to block. And you might see the terms an alpha blocker or an alpha adrenergic blocker, or which is a very common medication, is going to be a beta blocker. So we might look at those. On the sympathetic side, another word that you might see is an anti-cholinergic. So if it is an anti, it means it's against. So if it's against the cholinergic or against the parasympathetic system, you're going to have more of a sympathetic reaction. So I like to draw this chart and to think of the drugs in these different categories, because when I look at the drug, I think, all right, so if the drug is on this side, or if the classification is on this side, like for example, a sympatholytic drug, I know that it's going to be against the sympathetic, and I'm going to have more of a parasympathetic reaction. That always helps to kind of keep the categories and keeps the different reactions or types of situations or visceral stimulations in mind. I hope this has helped, and we're going to continue into the alpha and the beta reactions of the sympathetic system.